Next section, inflammatory mediator. Inflammatory mediators are chemical substances that initiate or participate in the inflammatory process. Mediators may be derived from plasma or the participating cells at the site of inflammation. The activity of most of these mediators is dependent on their binding to specific receptors on target cells, which may, in turn, release further inflammatory agents. Some mediators act only on specific cells. Others are less specific or may exhibit differing effects, depending on the type of cell involved. Some mediators, such as ROS, have direct enzymatic and/or toxic activities that do not require binding to specific receptors. Once released, inflammatory mediators are short-lived. Most mediators have potential harmful effects. The types of mediators are cell-derived mediators and plasma protein-derived mediators. Cell-derived mediators are derived from participating cells include the following categories: vasoactive amines such as histamine, serotonin, arachidonic acid metabolites such as prostaglandins, oxygen-derived free radicals and proteases such as oxygen hydrogen peroxide, cytokines such as IL-1 beta, tumor necrosis factor alpha, CSF, platelet activating factor, and nitric oxide. Plasma protein-derived mediators include constituent of kinase system, complement system, and clotting system. This table shows the function of important inflammatory mediators. For example, histamine and bradykinin contribute to vasodilation and vascular leakage. IL-1, IL-6, and tumor necrosis factor and PG can cause fever. PGE2 and bradykinin substance P can cause pain. And some mediators can cause tissue damage, such as neutrophil and macrophage lysosomal enzymes. Okay, now let's move on to the next section, clinical presentation of inflammation. Inflammation causes signs and symptoms at the local site. There are also systemic reactions to local inflammation. Local signs include redness, swelling, heat, pain, and loss of function. Redness is due to the dilation and increased blood flow. In the early stage, arterial dilation and increased blood flow make the affected part bright red. Later, the color is dark red due to venous dilation and congestion. Swelling is due to congestion, edema, exudation of fluid into the interstitial tissues. In chronic inflammation, swelling is due to proliferation of cells. Heat is due to the increased metabolism and producing heat caused by hyperemia. Pain is caused by swelling. The nerve's terminal may be pressed by swollen tissues. Some inflammatory mediators, such as PEG2 and bradykinin, can cause pain. Loss of function occurs as consequences of mediator elaboration and leukocyte-mediated damage. It's caused by necrosis, vascular changes, edema and pain, ischemia, anoxia. When acute tonsillitis occurs, the tonsils are red, swollen, and painful. When pyronychia, the skin is red, swollen, and painful. Inflammation can also cause systemic effects. Fever. Fever is characterized by an elevation of body temperature, which is one of the most prominent manifestations of the systemic response. is the result of combined action of endogenous and exogenous pathogen. Leukocytosis is an increase in the number of white blood cells in the blood. It's a common feature of inflammatory reactions, especially those induced by bacterial infection. Most bacterial infections induce an increased number of neutrophils. Chronic or viral infections are associated with increased number of lymphocytes. Allergic disease or parasite infection are associated with increased numbers of eosinophils. Some inflammation may cause proliferation of the mononuclear phagocyte system. For example, in typhoid fever, the mononuclear phagocyte system proliferates.